Good evening. My name is Ashlyn Hansen, and welcome to the 6 o'clock news. It is mid-December, and there is a high school that has already given up its basketball season. Why, you may ask? Well, reporting from Hyde Park is our news reporter Rachel with the story.
This school's once proud basketball team has come to its knees. Basketball courts around the city, like this one behind me, stand empty, and spirits are down. A disease has ravaged its way through the school, affecting 15 out of the 17 members of the basketball team. I talked to one cheerleader earlier today who has summarized how so many were infected.
So, Gwen gave it to Bobby. Bobby gave it to Trish. Trish gave it to Jack. Jack gave it to Bill, but Bill and Jack didn't kiss. Bill gave it to Donna. Donna gave it to Wendy, but Donna and Wendy never hang out, like, ever. Wendy gave it to Tyrone, and after Tyrone got it, 13 members of the team got it. No one knows how it happened.
The disease is known as infectious mononucleosis, more commonly known as mono or the kissing disease. We have come to talk with Dr. Ashley, who is going to explain to us a little bit more about this disease.
Mononucleosis is an acute infection, meaning that the infection will only last you a short period of time. It is commonly caused by the Epstein-Barr virus. This virus is a human herpes virus which replicates in the B lymphocytes or the epithelial cells of the pharynx, which would be the back of your throat, or the parotid duct, which is this area right here. This virus is spread through saliva, which is how mononucleosis got its name, the kissing disease. However, it can be spread through other ways than just kissing. Although rare, mononucleosis can be caused by other viruses, such as cytomegalovirus only has one reservoir, humans, where it lives and grows in the nose and throat. It is most contagious when a person becomes first infected and about 18 months afterwards. However, it can become active from time to time where it's able to spread. When it's not active, it lays dormant in the body. We see mononucleosis in teenagers, young adults, and college students. 25% of teens and young adults that become infected with the Epstein-Barr virus will develop mononucleosis. The Epstein-Barr virus is approximately 122 nanometers to 180 nanometers in diameter. The pink and purple chain in the middle is the viral genome. This is the virus's DNA. It is a double helix made up of 172,000 base pairs and about 85 genes. Next is the nucleocapsid, which is made up of proteins and surrounds the DNA. The blue circle surrounding the nucleocapsid is called the viral tegument, which is also made of proteins. The pink ring that surrounds the viral tegument is an envelope containing lipids. Therefore, this virus's morphology is enveloped. The green spikes protruding off the envelope is called envelope proteins, which are made up of glycoproteins and are essential to infecting a host cell.
Now that the basketball team has some openings, there are so many students who would jump at the chance to be on the team, but there are many parents who are concerned.
I told my son that he is not allowed to play on the team. I am afraid he might get mono. Who knows where it's coming from, and it sounds awful.
With this as a real concern for many parents, we turn back to Dr. Ashley for some advice.
Mononucleosis is spread through direct contact with saliva. This means that there are no barriers between hosts, so the virus is spread from host to host. Therefore, mononucleosis is spread through kissing, sharing drinks, utensils, lip glosses, lipsticks, chapsticks, etc. It can also be spread through the droplets of someone coughing or sneezing. If you suspect you have mono, make an appointment with your doctor. These are some questions that may be asked by your doctor. When did you develop symptoms? Have you been exposed to anyone with mononucleosis? Have your symptoms been continuous or occasional? How severe are your symptoms? What, if any, seems to improve your symptoms? What, if any, seems to worsen your symptoms?
The doctor also let us know what to watch for if you think you may have mono. She said that you can experience fatigue, headaches, sore throat, chills and fever, muscle aches, and loss of appetite. And then after a couple days, you could develop swollen glands, jaundice, a skin rash, and soreness from an enlarged spleen. She did mention that if you have experienced any these signs and symptoms of mono, to please contact your health advisor. Back to you, Ashley.
Thank you so much, Rachel. As mentioned, if you suspect that you have mononucleosis and are planning to go see your doctor, here is what you can expect. He or she will want to know of your signs and symptoms, how long they've lasted, and will perform a physical examination. They will look for signs like the swollen lymph nodes, tonsils, liver, or spleen. Different blood tests might be done, such as an antibody test, otherwise known as a monospot test, which checks your blood for antibodies to the Epstein-Barr virus, or otherwise known as EBV. We also learned that if you are diagnosed with mono, there is no specific therapy to treat it. Unfortunately, antibiotics do not work against viral infections like mono, and the most common treatment involves adequate bed rest and drinking plenty of fluids. Acetaminophen or other anti-inflammatory drugs can be taken to reduce fever. Corticosteroids may be prescribed to you to ease some of the symptoms, such as the swelling of your throat, but will not cure the mononucleosis. The one thing to be wary of is other infections that accompany the symptoms of mono. For example, streptococcal infection, or strep, can accompany the sore throat of mononucleosis. A sinus infection or tonsillitis are other possibilities when you have mono as well. If these infections arise, you will need to treat them with antibiotics as directed by your doctor. Now, this is for our Hyde Park basketball team members. Wait to return to sports and other activities. Most of the symptoms of mono will go away within a few weeks, but it may be up to 2 to 3 months before you feel completely normal. Take it easy. The more rest you get, the sooner you will feel better. Consult your doctor to inquire when it is safe enough to return to your normal activity level. One of the most important things to remember is that mono is spread through saliva. If you are infected, you can avoid spreading the virus to others by not kissing them and by not sharing food, dishes, utensils, or other like objects until several days after your fever has subsided, and even longer when possible. The virus may remain in your saliva for months after the infection, so it's better to be safe than sorry. A huge thank you to Rachel, our news reporter, and Dr. Ashley for her knowledge about mononucleosis. This is Ashlyn Hansen. Have a good night.
To recap what we've learned about mono. Mono is caused by the Epstein-Barr virus. Its morphology is enveloped. Its viral genome is DNA. The reservoir for mononucleosis is humans. The signs of mononucleosis, which means the objective or things that can be tested by a doctor, is fever, swollen lymph nodes in the neck and armpits, swollen liver and or spleen, and a rash. The symptoms of mononucleosis, which means subjective, or things that a patient feels or is experiencing, is extreme fatigue, sore throat, head, and body aches. The transmission of mononucleosis is through direct contact with saliva. This means the virus goes from host to host without there being a barrier. Treatment includes bed rest and plenty of fluids. Sometimes acetaminophen or corticosteroids are prescribed to help with inflammation. To prevent mononucleosis, you need to have good hygiene. This means washing your hands and covering your mouth and nose when you cough or sneeze to help prevent spreading it. You also want to avoid contact with infected people and avoid sharing things such as drinks, food, utensils, and chapstick. Possible complications of mono are the enlargement of the spleen, which could lead to rupture, hepatitis, which is a mild liver inflammation, jaundice, which is a yellowing of your skin and the whites of your eyes, anemia, which is a decrease in red blood cells and in hemoglobin, thrombocytopenia, which is low count of platelets, myocarditis, which is inflammation of the heart muscle, meningitis, encephalitis, and swollen tonsils. 90% of people over the age of 35 have been exposed to the Epstein-Barr virus. There are more than 3 million cases in the U.S. per year. EBV, or Epstein-Barr virus, could lead to or cause some cancers, such as Hodgkin's disease, non-Hodgkin lymphoma, oral hair leukoplakia, leiomyoma, leiomyosarcoma, nasopharyngeal carcinoma, and Burkitt lymphoma. It's rare that a person will get mononucleosis more than once.